Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, July 28th, providing you the update from Albany Medical Center. All right, the COVID numbers. First graph is the capital region, 8 counties. These are people admitted and currently being treated for COVID-19. Fred, 38, so that number is hanging in the 30s.
Yep, it's just hovering there.
Okay, very good. Next graph is Albany Medical Center admissions and discharges, and you can see again the pattern remains the same. We may admit 1 or 2, we may discharge 1 or 2. And now let's flip to the next graph, which is our morning census. Fred, we currently have 16 in the hospital. Looks like 15 on the floor, 1 in the ICU, none on the ventilator. So we're in that 10 to 20 range, and we have been now for a couple weeks.
It's actually, Dennis, a month now.
About a month.
We've been a month hovering in that range.
All right, so we'll keep a close eye on that. Fred, let's talk a little bit about something that was in the news yesterday. We run a child care center called Albany Med Kids.
That's right, Dennis.
Used to be called the Kids Keller.
Yep.
Kids Keller. And as was reported yesterday, we had a staff member there who tested positive for COVID, and so we took some steps to explore that a little bit deeper. As a result of that, we decided to close the AMC Kids for 2 weeks. So let's talk about that. Fred, what's the background?
So the background is that staff member was actually exposed to a family member who was positive.
So community acquired.
Community acquired.
Okay.
Did the right thing, immediately got tested, turned out to be positive.
Yes.
And then that started a cascade of changes that we needed to make, testing we did, and the ultimate closure for these 2 weeks.
The staff members who work at Albany Med Kids wear masks in the classroom all the time. Okay.
But the children don't.
The children don't. And we did end up testing children. I think we tested 62 children, and I think 7 came back positive.
That's right. And none of them are symptomatic.
Okay,
but
very good.
They did test positive. That's right, Dennis.
So none positive, none have had to come into the hospital, been treated. As a result of that, working with our Department of Epidemiology and the County Health Department, out of an abundance of caution, decided to send home for 2 weeks, terminal clean, look at our processes, and then open up again in another 2 weeks.
That's right. So somewhere around August 10th will be the reopening.
Okay, very good. So obviously to those who work over there, we think that we thank them for practicing safely, wearing the masks, and we'll do the right thing and we'll open up in 2 weeks.
Absolutely.
Okay, very good. Fred, today is Tuesday, so the governor typically updates the quarantine state list, and I think the list actually has gone up.
It has, Dennis. So 5 localities have been added. So Kentucky, Illinois, and got to look, Minnesota.
Okay.
So now 34 states are on the quarantine list, plus D.C., Washington, D.C., and Puerto Rico. So it's really a very significant part of the country that has a surge of COVID and is on our quarantine list.
So what that means for us is obviously as visitors come in and as our staff come back, we have a process obviously to ask that question. Fred, I think this weekend we actually opened up a new annex location where staff members can come and be checked.
That's right, Dennis. So to try to relieve the crush on Monday morning, on Sunday afternoon we opened up, actually up on F2, I think, again, where we had been doing testing during the pandemic earlier, for staff members who traveled and were coming back and needed to be tested before they could come back to work. So we tested 14 people there. Then on Monday we tested 31 people in employee health.
Right.
But if you're traveling and coming back and need to be tested, one of our employees, take advantage of that Sunday afternoon.
It sure is an important thing, and it's very important for our staff members. We obviously don't know that they've left the state. They have to self-report that when they come back, so it's important for them to know we have that resource available to come in and get checked before they go back to work.
Professional responsibility.
For sure, for sure. Speaking of professional responsibility, Fred, we talk a lot about wearing masks around here, but as we talked about, there are other things that we need to do to protect ourselves and to protect our staff. And one of those things is over a century old, which is washing hands, right? I mean, some very important studies were done over a century ago that showed that can reduce infection. And I think that this is something that even pre-COVID, we would do some secret shopping on, and we would check and see whether or not our staff were washing our hands. We've always had good numbers, but I think recently we have some more data.
That's right, Dennis. So actually the nursing organization decided at the beginning of the year that they were going to do a quality improvement project. So they were going to really focus on hand hygiene within the organization. Yes. So every nursing unit is supposed to audit a certain number of their staff every day. And report when someone hasn't done appropriate hand hygiene. to the person
Right.
and real time try to correct that. So that's been going on even pre-COVID, and actually the most recent data is really pretty good. 20 of our units are in the green.
In the green.
So they're hitting all the metrics that they laid out for this quality improvement project. And one unit's actually doing something really interesting. The apheresis unit actually is having the patients audit their caregivers. So at the end of their treatment, they're asked to fill out a form. Did your caregivers wash their hand before and after? That's absolutely fantastic. Kathy Gregg is the nurse manager there. Shout out to her. That's just terrific. So 20 units in the green. That means there's some units that aren't in the green. So this is a challenge from Steve Corey, the AVP who's running this project. To those not in the green, get in the green.
Get in the green. Get in the green. So it's not just masking. It's also hand hygiene. It's also eye protection at the bedside. It's all those things together.
Things. Very important.
All right.
Very important, Dennis.
Fred, there has been a lot in the news lately about vaccination and trials and stuff. Maybe on Thursday we can update what the status of some of those trials are. I know some are in phase 3, and it might help for us to explain to our workforce and others what's going on out there.
I think that's a great idea, Dennis. It's really quite exciting. If those phase 3 trials pan out, then we have vaccines.
All right, great. So we'll update that on Thursday. We had mentioned that on a going forward basis, we are going to have members of our workforce, management, and frontline providers appear in these videos going forward. So I think pretty soon we're going to have the dean on the video. So we look forward to that. And one of the reasons we're going to do that is the college is starting its new academic year. So I'm sure that Dr. Verdial will talk about other things. But Fred, let's welcome the incoming class of Albany Medical College 2024 who are coming on campus, I think, this week.
That's right. Welcome to Albany.
Welcome to Albany. And I was Albany Medical College class of 92. Let me share some statistics out there. So we are seating a class of 145 students, which I believe is
that's the largest I think we've ever had.
Largest class ever. There are 99 who are coming in the traditional admission process, but there's another 46 that come in via different pathways. We have partnerships with several area colleges like Siena, Union, RPI, where people will get accepted to medical college but go through undergrad first as part of a 6 or 8 year process.
That's right. So they get accepted almost simultaneously, if you will.
And you were mentioning the RPI program is a well-established program.
Absolutely. I remember it growing up back in the 70s. I hate to date myself, but...
This is also the first year we are seating 4 students from the University at Albany who are part of what's called the Early Assurance Pathway Program, and these are students who are underrepresented in medicine. So this is our first class with 4 of them coming in, which is also great news. Smart class, GPA 3.7, 54 of them are from New York State, and I do love this statistic. 11,343 applications for 99 seats. So,
amazing, isn't it?
An incredible class. So congratulations to all of you, and we look forward to the great things that you will do. All right, and we'll hear from the dean either this week or next week.
That's right.
All right, good. Anything else, Fred?
No, I think that covers it, Dennis.
All right, we'll be back Thursday. Let's talk about vaccines Thursday. Until then, we ask that you please take care of yourself, take care of each other, and we'll see you in 2 days.